Today, you'll learn more about your Medicare Advantage plans for 2021. If you're joining us for one of our live question and answer seminars, you'll have the opportunity to have your questions answered at the end of this video. We can also speak with you directly after the session. However, you'll find many of your questions will be answered during the presentation. If you're watching online without a host, we will advise you on what to do next at the end of this presentation. Every year, we mail the annual notice of change to our members detailing the changes to your plan from one year to the next. This will be a helpful resource to refer to during the benefits portion of this presentation. Along with your annual notice of change, you should have also received a notice of electronic document availability, informing you that you can access your evidence of coverage, provider and pharmacy directories, vision and dental directories, and the formulary online, or request paper copies on or after October 15, 2020. The evidence of coverage is our contract with you. It explains how to obtain coverage for healthcare services and prescription drugs, provides an overview of benefit details, important phone numbers and resources, and even what to do if you're having problems or concerns. The comprehensive formulary is a list of drugs covered by your plan and outlines what you pay through each coverage stage. You can locate this at azbluemedicare.com under Members, then search Drug List. The Provider and Pharmacy Directory is a list of our contracted providers and pharmacies. This list is constantly changing. You'll find the most updated information available on our website, azbluemedicare.com, under Members, then Provider Search. The Silver and Fit enrollment flyer can be mailed to you to assist you with your health and fitness membership. Enrollment periods are times when you can enroll, disenroll, or change your plan. We are now in the annual election period, a time frame when you can make changes to your health or drug plans or switch to Original Medicare. During the Medicare Advantage open enrollment period, you can make one change to a different Medicare Advantage plan, including Part D, or switch back to Original Medicare and join a standalone Medicare prescription drug plan. Any changes you make will be effective the first of the month after the plan receives your enrollment. You may qualify for a special election period under certain conditions, such as aging in to Medicare eligibility, moving out of your service area, a change of income, or a diagnosis that qualifies you for a special plan. Please see your broker or sales representative if you believe you qualify for a special election period. Now, let's review the ABCDs of your Medicare Advantage plan. Part A covers hospitalization and facilities. This includes hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B provides physician care and helps pay for doctor's services, outpatient hospital care, durable medical equipment, and some medical services that aren't covered by Part A. You most likely received your Medicare Parts A and B when you enrolled for Original Medicare through the Centers for Medicare and Medicaid Services. Part D is your prescription drug plan. If you did not sign up when you were first eligible and did not have creditable coverage, you may be subject to a late enrollment penalty. Creditable coverage, for example, from an employer or union, must pay an average of at least as much as Medicare's standard prescription drug coverage. And Part C is your Medicare Advantage plan. That's us. A Medicare Advantage plan is a type of Medicare health plan offered by a private company that contracts with Medicare. We provide your Parts A, B, and D benefits all in one plan. There are different types of Medicare Advantage plans, which include Health Maintenance Organizations, or HMOs, and Preferred Provider Organizations, also known as PPOs. In an HMO plan, like our Blue Advantage Classic and Blue Advantage Plus plans, you receive your care within our service area, in this case, Maricopa County. You have a primary care provider who oversees your care and provides you with referrals to see specialists and receive services within the plan's network. Our Blue Journey plan is a PPO, which allows you to receive care from providers outside our preferred network. However, you may pay more to do so. As a Medicare Advantage Plan member, here are some terms you may see or hear frequently. A copay, or copayment, is a fixed dollar amount you pay. For example, you may pay $7 or $9 when you pick up your next Tier 2 medication. Coinsurance is the percentage you pay for your share of the cost of a service, drug, or equipment. For example, durable medical equipment rental is 20% of our contracted rate for that item. A deductible is an amount you must pay before Blue Cross Blue Shield of Arizona pays our share of your medical services. The Formulary is a list of covered medications. You can request a list or go to our website to view the list. The maximum out-of-pocket, or MOOP, is another term you'll hear. This is the most you might pay in a calendar year for Part A hospitalization and Part B medical services. This is your safety net and protects you from catastrophic costs. For HMO members, once you've met the maximum out-of-pocket, you will not be responsible for Part A and B payments for the remainder of the calendar year. Part D is separate and will be discussed later in this presentation. For PPO members, out-of-network expenses will apply to your out-of-network maximum out-of-pocket. Remember, if your plan has a monthly plan premium, you will still be responsible for this payment. We will review actual dollar amounts for your plan in just a few moments. Prior authorization and referral are also frequently used terms. Prior authorization is a request from your provider for you to receive a service or test. Your provider requests approval from the plan and is responsible for ensuring that approval for your prior authorization is received prior to your scheduled appointment. The standard time frame is within 14 days. If you're having issues, please call Member Services for assistance. A referral is an approval from your primary care provider to see a specialist or go to a facility. Do I need a referral? We get this question a lot. If you're on one of your HMO plans, then the answer is yes. You do need a referral to see a specialist. However, there are a few exceptions, such as routine women's health care, emergency and urgent care, kidney dialysis when you're temporarily out of your service area, and outpatient mental health and substance abuse services. For additional information, please refer to Chapter 3 of your Evidence of Coverage or contact Member Services. The Blue Cross Blue Shield of Arizona Member Identification Card will be the only card you need. Please use this card instead of your red, white, and blue Medicare ID card. If you receive a service and mistakenly use your red, white, and blue Medicare ID, you may be charged 20% for your care instead of the appropriate copay or coinsurance based on your plan. If you're unsure about which plan you're on, please refer to your Blue Cross Blue Shield of Arizona ID card or give us a call. We will now review 2021 benefits for Blue Medicare Advantage HMO plans, including Blue Medicare Advantage Classic and Blue Medicare Advantage Plus in Maricopa County. In addition to reviewing your plan's copays and coinsurances, we'll also review the plan's maximum out-of-pocket and individual benefits. Benefits are even richer with lower costs for Maricopa County members in 2021. Blue Medicare Advantage Classic HMO members will still have a $0 monthly plan premium, and the maximum out-of-pocket remains at $4,250. There is still no cost for primary care provider visits, as well as for routine lab work. Physical, occupational, and speech therapy will still be $35 per visit. Blue Medicare Advantage Plus HMO members will have a monthly plan premium of $43 in 2021, and the maximum out-of-pocket remains at $4,250. Primary care visits are no cost. Members will still have an annual routine dental exam, including routine cleaning and bite wing x-rays, with a $500 annual maximum. Physical, occupational, and speech therapy visits continue to have a $20 copay. However, members on both Classic and Plus plans undergoing physical, occupational, or speech therapy will now only have one copay per date of service, per type of therapy. Also new in 2021, a Medicare-covered acupuncture benefit has been added for $30 per visit. More great news. Members in all our plans can now purchase a 100-day supply of all Tier 1 and Tier 2 drugs for just one copay. This means Classic Plan members can receive a 100-day supply for $0 or $9 for your Tier 1 and Tier 2 medications. That's right. Tier 1 medications dropped from $3 to $0 copay. Tier 3 preferred brands are $47. Tier 4 non-preferred brands are $100. And Tier 5 specialty medications are a 33% coinsurance for a 30-day supply. Plus Plan members can also receive a 100-day supply for $0 or $9 for Tier 1 and 2 medications. Tier 1 medications decreased from $3 to a $0 copay. Tier 3 preferred brands are $40. Tier 4 non-preferred brands are $90. And Tier 5 specialty medications are a 33% coinsurance for a 30-day supply. We'll now discuss the coverage gap and Part D cost sharing for our plans. Let's take a look at the prescription drug stages. Regardless of the Medicare Part D prescription drug plan you select, it will have 4 stages of coverage. Stage 1 is the yearly deductible. However, your plan does not have a deductible in 2021. Stage 2 of prescription drug coverage is called the initial coverage limit, which set by Medicare increased this year to $4,130. The initial coverage is a combination of both what the member and the health plan pays. When you and the plan have cumulatively reached $4,130, you will move into the coverage gap. Stage 3 of prescription drug coverage is called the coverage gap. In this stage, members pay 25% of the cost for both brand name and generic drugs until their total out-of-pocket costs reach $6,550. During this stage, both what the member pays and whatever discounts they receive from drug manufacturers are applied to the member's true out-of-pocket costs. Stage 4 is the catastrophic phase, and the member will pay the greater of 5% for generic and brand name drugs, or $3.70 for generic drugs and $9.20 for brand name drugs. The Medicare Part D prescription drug benefit will reset every January 1st. Please note the list of covered drugs can change during the year. You may have seen the benefit of blue in our advertising, but what does it really mean? To us, it means being there for our members and providing them with peace of mind during times of uncertainty. During this time of uncertainty, Blue Cross Blue Shield of Arizona has been there for our members, giving you the reassurance and confidence to know we're here to help no matter what. During the COVID pandemic, we've enhanced our benefits by including $0 out-of-pocket costs for telemedicine visits with a doctor by computer, tablet, or mobile device, extended 90-day prescription drug supply, and online fitness classes through Silver and Fit to help members stay active and engaged. In addition, we delivered over 83,000 face masks to our members to ensure our most vulnerable population has access to masks to help aid in the fight against COVID-19. Telehealth with Blue Care Anywhere is a safe and convenient way to meet with healthcare providers in the comfort of your own home. An internet connection and a smart device will connect you to this valued resource at no cost. We want you to stay happy and healthy. So take advantage of our My Blue Medicare Wellness Rewards program, and you can earn a $25 prepaid MasterCard just for having your preventative screenings. With our My Blue Medicare Wellness Rewards program, even getting your flu shot will earn you a $10 reward. Routine vision services include a non-medical examination and must be performed by a preferred provider through the Davis Vision Network. Please contact Member Services for a directory of Davis Vision providers or assistance with scheduling your no-cost routine vision exam. Medicare-covered eye exams are performed by an ophthalmologist or optometrist and include diagnosis and treatment of diseases and injuries of the eye, such as diabetes, glaucoma, cataracts, and macular degeneration. Your specialist copay will apply. Do you have a new prescription and you're looking for new glasses? Blue Medicare Advantage Classic and Blue Medicare Advantage Plus members have a $150 allowance every 2 years for hardware. True Hearing offers personalized care to help you through the process of scheduling your routine hearing exam and selecting and obtaining the right hearing aids for you. Blue Medicare Advantage Classic and Blue Medicare Advantage Plus plan members can also upgrade to rechargeable premium hearing aids for a $50 upgrade fee. Hearing aids are quoted per hearing aid, not per set. Call True Hearing to get a complete comparison. Silver and Fit provides access to numerous resources to keep members active from anywhere, including 48 healthy aging classes online or on DVD. There are daily workout classes on Facebook Live and YouTube, Signature Series workout videos for all fitness levels on silverandfit.com, more than 280 digital workout classes on the Silver and Fit ASH Connect mobile app, and a quarterly member newsletter. Members also have access to healthy aging telephonic coaching, 2 free DVDs, and a no-cost Garmin or Fitbit to help you meet your fitness goals. Please contact Silver and Fit and mention your free Garmin or Fitbit first when discussing DVD availability. Let's stay active. Go electronic and receive more of your information from us through email. We started in January of 2018 with 3,000 members enrolled, and now we have over 13,000 of our Medicare Advantage members receiving information electronically. We encourage you to sign up either online or by calling Member Services. Thank you for being a Blue Cross Blue Shield of Arizona member and for taking the time to review this presentation with us. Here are a few things to know about the gift card you'll receive for joining us today. It's a $10 value, good for use at your neighborhood grocery store. We'll mail it to the address you have on file with us. And please, allow 3 weeks for processing of the gift card orders and delivery. We look forward to serving you in 2021. When it comes to Medicare Advantage plans, we truly have something for everyone. Access to specific doctors and hospitals in your neighborhood network, to broader access with even more doctors and hospitals. We have plans with low annual maximum out-of-pocket, to a PPO option with in-network and out-of-network cost sharing for more choice. Plan options range from $0 to low monthly premiums. What should you do next? If you want to remain on your current plan, you don't need to do anything. Your membership will automatically renew and you'll receive your 2021 member identification card and any requested materials in December. If you have any questions about one of our other Medicare Advantage plans, please reach out to your broker or one of our licensed Medicare consultants at 1-888-274-0367, TTY-TDD 711. If you have any questions about your current plan, please don't hesitate to contact us. Member Services is here to assist you. Thank you for being a Blue Cross Blue Shield of Arizona member. We look forward to serving you again in 2021. We will now start our live questions and answers portion of our presentation. Your meeting host will join you momentarily. In order to protect your personal health information, your questions will not be visible to other attendees, but will be shared if they're appropriate for the group. We will do our best to address your questions, or we'll research your concern and a team member will contact you after the presentation.